I'm Dr. Ramesh Hussain. I'm the vitreoretinal surgeon for Dr. Agarwals Eye Hospital, Mauritius. And I'm going to talk about most advanced machine for retinal imaging. The machine's name is OCT Angiography. As you know that the retina is one of the most major layers for the vision, because that is a layer which catches the light and sends to the brain. So I will explain you with this model. So this is an eye model. So if you see the front part here, you will have the cornea, then we have the lens inside where you get cataracts and all, and then the inside of the eye, this yellow layer is what you call as retina. So light will pass through the cornea, through the lens, and falls on the center part of retina and then goes to the brain. That's how we see. And this retina has to be healthy throughout the life for a good and fine vision. Now, most of the disease affecting the retina is because of its blood supply, the blood vessels. And whenever you have a problem because of diabetes, because of age, because of injury, because of inflammation, for anything we have to evaluate the blood vessels. For that, many years, like more than 40 years, we have something called angiography of the eye. It's something like same like angiography of the heart. You inject a fluorescent dye into the veins and then take photo of the retina with a special machine. But then this has got problems, like very elderly people, sick people, people with renal problems, children, pregnant ladies. We can't do that because the dye can have adverse effects. And many of the time without a proper evaluation, we have to just start the treatment. Now this machine, the OCT angiography, is the latest one, as I told you, like 3 years in the market across the world. And this machine doesn't need a dye. Without a dye, within 10 seconds, you can do the imaging of the blood vessels. And most of the diseases, most of them, not all of them, most of the diseases, we can find what is the real problem with the blood vessels with this machine. The advantage is that, as I told you, there is no need for a dye. The second thing, the timing. So this machine, particularly the Revo NX, what we are having in Agarwals Eye Hospital, is the fastest OCT in the world. So it takes less than 5 seconds to take the scan. So that means you will get more accurate results. The more you are exposed to something, some kind of a machine, the more distractions and more errors. So the fastest machine means you will get least errors. So that's why it is important to have a fast scanning machine. And second thing is that, as I told you, because we are not doing any dye, we can do it for elderly people, very sick people, like people who are having renal issues or very cardiac problems, or recently done any surgeries who cannot have the dye to be injected. Those patients, we can easily do the scan and evaluate the eye. So it is very important to have a proper scientific diagnosis before starting a treatment. So this machine helps us a lot. Previously we used to send people abroad to do this scan, and further evaluation and further management. Now in Mauritius we have this machine. To our knowledge, this is the only machine in Mauritius, and people are benefiting it, and at a very affordable cost than anywhere in the world. If you see, this is the OCT angiogram picture, very similar to the conventional angiography, and much clearer, and you can see the vessels very clearly. And here you can actually assess each layer by layer, what is the problem with the blood vessels. And this is superficial vessels, this is about the deep vessels, deep plexus, then this is the more deeper layer, and this is something called choriocapillary layer. And here you can actually scroll and see which area, which point the blood vessel is damaged, or any new growth is happening, or any other issues happening. So this is how we immediately assess the OCT angiography within few seconds.
So one question, yes. Which is from these 4 frames, which is the most important that you look?
This one. This is the center point of the retina. You can see the most important part of the retina, and this is the area we want to study in any case of retinal problem, because center part is the most important part. And what you're seeing, these lines, these are the blood vessels. You see each line. So if there is any problem, it will show up here. So this case is kind of normal retina. You can see all the normal blood vessels. The center part has got enough blood circulation. There are no abnormal blood vessels, no growth or abnormal membranes, nothing is there. So it's quite a normal retina. So if you have a problem, it will show up here. You will show that, so okay, there is a membrane here, or there is some kind of problem with the blood vessel, or the blood vessel is blocked, or a particular area there is no blood circulation, everything will be showed up in this image.
It's very special condition, Dr. saying that we need to see you here to do that OCT angio.
Yeah. So there are many conditions affecting the retina. The most important one I want to stress is diabetes, which is very prevalent in our country, and a lot of youngsters are getting affected nowadays. I see a lot of youngsters. So the thing is that it is a must that every year a diabetic patient, once diagnosed as a diabetic patient, they have to visit an eye doctor to check the retina, any eye doctor. And they are all trained to see if they have any retina problem. And once they have a retina problem, they have to refer to a retina specialist. So they have the equipments and machineries to diagnose and treat the patient. So in our armamentarium we have this OCT angio, which I told you, which is quite easy and fast to use and much advanced to get the finest problems in the retina, like the smallest problem in the retina.
You were talking about diabetes. Is it diabetes type 1 or type 2?
Both of them.
Both
See,
of them.
type 1 is like, once you are diagnosed, you need to check the retina after 5 years of onset of disease. But type 2, which comes in the elderly, it is actually, you don't know when diabetes started. So better once you are diagnosed as a diabetic, have an eye checkup. That's one message I want to give everyone in Mauritius, because most of the time you will be seeing very well, everything will be fine. But remember, you can have advanced diabetic problem in the retina with absolutely normal vision. Suddenly it happens, So the vision will be affected only when the center part of the retina is affected. Till then there won't be any problem with the vision. So we will not know if the sides or the inferior part or the superior part is getting affected. So only way is to do screening. And
Other symptoms? When do I need a symptom? Maybe some black spot or white spot, I don't know.
Yeah, for diabetes, yes. For diabetes, if you are a diabetic and is not well controlled and suddenly you are seeing there are some floaters or the vision is a bit blurred, the most common cause for decreased vision in diabetes is for the eye is for the retina is like swelling in the center part of retina. It's called macular edema. That's the most common cause of vision loss in diabetes. So macular edema, when someone has macular edema, they won't be able to read. Mainly the reading vision goes off. Or when you look at a face, everything else is okay, but the face is a bit blurred.
Yes.
Or when you read something, the letters are jumbled, or it's not clear. When you see a straight line, it looks like a curve. So these are the signs of a diabetic macular edema. That means swelling on the center part of the retina. It's very important to treat it immediately, because once it becomes chronic, it's very, very difficult to treat, and it takes a lot of time and effort to make it all right.
So according to what you've said, the Revo NX, you don't need chemicals to use it.
For this machine, absolutely no need for any dye, and a patient has to just come and sit like this, keep their chin for a few seconds, it is done. So as I told you, the more fast the machine is, more accurate we get, because patients will not be distracted, they won't blink, they won't move their eyes. So it's very important to get a good image, good result to analyze it.
We are in Mauritius, we are really afraid of machines, so there's no some cosmic rays, there's no X-rays. Tell me something to say someone who is 70 to his 80s, who is going to come here to see you and see this machine, and then won't know what is going to penetrate his heart to have this, because when I've seen the film, there is a very big technology behind it.
That's true, sir. So the thing is, this machine is FDA approved with a lot of clinical trials and many years of research, and this machine uses a very, very fine, refined light, and it doesn't cause any harm to the eye. So early 2000, when the OCT machine was invented, the original OCT machine was invented, that time it was like a revolution for treatment of retina, because you can see the cut section of the retina and you can analyze each layer. So now from across the years, it has improved to a stage that other kind of test like angiography can be done with the same machine, same technology. So again, the light which we use to take the scan is kind of very, very safe. It is proved. It is approved by the FDA. And second thing is that this machine particularly, as I told you, it's few seconds. So the exposure is very, very less. Even if you are intolerant to light, they can also actually do the test very easily, because it's like 10 seconds it is done.
Is this going to become standard maybe in 5-10 years? Do you think?
To be very frank, we were trying to get this machine for the past 3 years once it was launched in the market in the world. But now, at least now we got this machine in Mauritius. But in Western world and in US, it has become the standard. So now they have decreased the number of the conventional angiogram which uses the fluorescein dye, and they have turned to this one, especially for follow-up. For example, you have diagnosed a condition. Now you are treating them. Now you want to know what is happening. You cannot do every time that dye angiography. So this is very easy to follow up. Next time after the treatment, you again do a scan and see what is happening, because this is very repeatable and reliable and safe also.
Can it be used? I mean, for some eye surgery, post-operational eye surgery that you make here?
Yes, because there is a condition called macular hole, and macular hole is a hole in the center part of the retina. And see, when you do surgery, we have done everything fine, but we need to know whether the hole is closing or not. So if it is not closing, we have to intervene within 2 or 3 weeks. So what we do is that immediately after 1 week, sometimes after 2 weeks, we do the scan and see whether the hole is closing or not, so that we can plan the next level of treatment.